Hello everyone, welcome to this CaCHE webinar and thank you for joining us. Today, CaCHE launched a report on motherhood and homelessness, and we're very lucky to have Dr. Kesia Reeve and Dr. Emma Bimpson, the two lead authors on the report from the Centre for Regional Economic and Social Research at Sheffield Hallam University, and they're here to discuss the findings from the report and also to take questions, any questions that you have. So the way we're going to structure this is I'm going to pass over very shortly to Emma and Kesia, who are going to lead the presentation. The presentation is going to go into a decent amount of depth, so it's going to take about half an hour. And then following that, I'm going to chair a Q&A session. So throughout the presentation, I'd invite you all to write any questions that come to mind in the chat box. And then once Kesia and Emma finish the presentation, then I'll kind of collate those and put some of the questions to them. So without further ado, I'll pass over to, I'm going to disappear and pass over to Kesia and Emma.
Thank you very much, Chris.
Thanks, Chris.
Thank you. And also thank you to everybody who's joined us and is taking a bit of time out of their day to spend the next half an hour to an hour with us. So thanks very much for that. As Chris said, we're going to be, if I can just, sorry, I'm just trying to move my presentation on. Yeah, there we go. Emma and I are going to be talking through the findings from some research that we've recently done focused on homeless mothers. We thought it would be useful to start just by giving you a little bit of background to the research and a bit of information about the study. I will try and move on as quickly as possible to get to the findings from the research itself, but we thought this would be helpful. We're not necessarily going to cover everything on the slides. The report is published today, so that's on the CaCHE website. Chris may have already said that. So all of this information is in that report as well. So and obviously there's Q&A afterwards. So we're going to talk around some of the slides. I've been doing homelessness research for about 20 years, and during that career, there hasn't been very much space for exploring the experiences specifically of homeless women. I've very rarely been commissioned. I have occasionally, but I've rarely been commissioned to focus on women as a distinct group within the homelessness population. Yet what I do know from my research is that obviously women share many experiences with homeless men, but there are aspects of their trajectories into homelessness, their experiences and their needs that are different and that do demand, I think, a kind of more gender sensitive understanding and also service provision. One of those issues is motherhood, which is not to say that homeless men aren't fathers as well, but issues around parenting, around motherhood, around living apart from your children, around maternal health and well-being, have always come out quite strongly in the interviews that we've done with homeless women. But again, there's rarely been much scope, certainly for me, and I know for other scholars and researchers, to be able to report and focus on that. So, you know, we decided that we really wanted some room to explore the issues specifically around for homeless mothers. And try and get this issue a bit higher up, not just the policy agenda, but also the research agenda. So that opportunity came with our involvement in CaCHE. So the research was funded by CaCHE, and also we got some additional funding from our institution, Sheffield Hallam University. It was a small study, so the idea for us very much is this is a starting point, and we wanted to do a small scoping study to try and explore some of the issues facing homeless mothers, so that we could really build an evidence base, you know, from a solid starting point, find out what the issues were, and hopefully we're going to continue this program of work. So we did 26 qualitative in-depth interviews. They were very open-ended. We weren't going in with a really clear idea of what we wanted to know. We just wanted to understand their experiences and pull those key themes out. It is important to note that it was only conducted in England because housing is a devolved responsibility, and so homelessness legislation in particular operates differently in the four nations, and in Scotland has quite a different environment to England. So these findings that we talk about today really might have looked different if we'd done the study in Scotland. That's something maybe we'll do at some point. So it's mainly based on 26 interviews with homeless mothers, but we also had discussions with stakeholders as well, partly in the preliminary sort of design phase, but also to help us understand some of the processes that the women had reported going through. They were all homeless at the time that they were interviewed. We think it is quite important to point out that there is legislation and that does, in theory, protect homeless people, families, this group that we're looking at. We've had 30 years of the Children's Act, that was, you know, designed to protect the welfare of the child. There are principles in there around the welfare of the child being best served within the family. And the homelessness legislation in England has strengthened over the past few decades. Started in 1977. In 2002, people escaping domestic abuse were added to the priority need groups, and that, as we'll see, affects many of the women that we interviewed. And more recently, the Homelessness Reduction Act. So we've had a strengthening of our homelessness protection. And key to that is the priority that is given to families. Again, in England, this is not any longer the case in Scotland. The priority given to families who are homeless is really enshrined in that legislation. The problem is issues are raised with the implementation of some of that legislation. Academics and others have suggested, for example, that the principles of the Children's Act are not always supported in practice. Brid Featherstone there has described it as a blunt instrument. A recent guide for social work has suggested that the circumstances of poverty that women are often, or families are often living in, isn't sufficiently taken into account in social work practice. And there is a lot of homelessness research that looks at the kind of shortcomings of the implementation of some of the homelessness legislation, you know, in a context of scarcity. Very rigid assessments of people's vulnerability, very, very loose assessments of intentionality, which in the homelessness legislation, if you are intentionally homeless, the local authority does not owe you a duty. And I've certainly seen that widen in my career. So there are real issues raised about the protection that does exist. And I guess that's why you end up seeing the women, the kind of women that we saw in this study. So a little bit about them. They were all homeless with very little immediate prospect, it appeared, of permanent rehousing. Many of them had been in temporary accommodation for quite a long time. They had been provided with temporary accommodation mostly, but they'd been there for a long time. Very few were awarded priority need. And that included some who had become homeless escaping domestic abuse. 18 were separated from at least one of their children. And all were living in poverty at that time. And so that's where you get a bit of a disjuncture there between the reality for some people and that protection that exists in the legislation, and perhaps start asking questions about what is going wrong there. I'm going to hand over to Emma to begin our discussions of the findings. We thought it would be a good way to start to actually begin with a case study, and this is one that highlights a lot of the themes that we want to talk about. Although I would like to make the point that, you know, we could have picked one of very, very many to do this. It's not that Harriet is the one that sort of identifies all these themes. We could have picked any, but I'll hand over to Emma to begin there.
Yeah, this one, as Kesia said, sort of highlighted pretty much all of the sort of common themes and experiences that we've kind of drawn out in the research findings. So I'm just going to quickly read through this because I think it's really, there's some really key factors in here. So Harriet was interviewed. She was in a domestic violence refuge at the time. She'd been there for many months and actually had no knowledge of when she might have been rehoused. She had a 7-year-old child from a previous relationship, who was living in another city, living between his father and grandparents. She also had a baby with her in the refuge. She'd been moved out of local authority, and that was for the safety of Harriet's baby. The baby's father had been incredibly violent. So she was moved out of the city. Harriet was really concerned with her eldest son's schooling. So she was actually going over to try and do the school run, travelling from city to city, using very limited funds to get buses and to try and see her son. She didn't want to bring her son to the refuge because she didn't want to disrupt his schooling by moving him out of his home city, but also because her son felt really uncomfortable in the domestic violence refuge. Harriet reported having been refused Band B priority from the local authority for fleeing domestic violence. She had a lower banding, which a support worker at the refuge was trying to appeal. She'd actually been offered temporary accommodation from her local authority in the city that she'd moved from, but she couldn't accept that because if she did, she was at risk of having her baby removed by Children's Social Services for her failing to protect her youngest child. So she was caught in this awful situation where she couldn't be in the city with her oldest child for risk of losing her youngest child, and she had no idea when this situation or how this situation might be resolved. So it's an incredibly distressing situation to be in. So that case study really kind of highlights a number of the sort of key themes, and if we break them down into 4 areas, we see a really distinct link between the experience of becoming homeless and domestic abuse and violence, but also family separation. So in other words, housing and homelessness policy and provision weren't adequate to prevent or relieve homelessness or domestic violence for many of the mothers that we spoke to, which had direct implications for family separation or reunification afterwards. We found that housing policy and provision wasn't aligned with the same aims of Children's Social Services where homeless families were concerned, especially where mothers had been separated from their children, however temporarily, and then at that point being classed as single mothers, they lost entitlement to family housing. So this was a really critical issue. We saw that very particular ideas about maternal responsibility, in spite of situations of abuse, poverty, and lack of real housing options, were evident in the accounts of the women that we interviewed. And also the housing and wider welfare support provided to the mothers we spoke to was broadly inadequate and failed to recognise the situations of poverty that many of those women faced, and creating situations of isolation also made parenting, the act of parenting, incredibly difficult. So domestic abuse was a really kind of key factor, and we know that domestic abuse is a trigger for homelessness, particularly for women. And I think it's important to say here that within our sample, all the women described heterosexual relationships, but of course domestic violence is also a particular issue to people in the LGBTQ community, which carries very particular research implications. But within this case study, we were looking at mothers and male partners. So domestic violence and homelessness are fully intertwined, but we think it's really important to bring child separation into the picture. As we can see in Nicola's quote there at the top, the sequence varied. In some cases, children were removed because of domestic violence in the home, where women either left their partners to find somewhere to go, or developed issues such as mental health deterioration, alcohol, substance abuse as a result of the violence, which then led to situations of family separation. So they were sort of very complex and multi-directional processes, but you know, they were very sort of distinctly there. A point we really want to highlight is the way that housing didn't appear to be recognised, so the housing need that the mothers had. So women sometimes articulated their reasons for remaining in a home where abuse was taking place due to the lack of any other housing options. But this was often interpreted as women failing to keep their children safe from violence. And this tension is clearly articulated by Kelly in that quote below right there.
Okay, Thanks, Emma. This I think was one of the sort of starkest issues to emerge from the research, but also the most troubling, that the women that we interviewed, because of their circumstances, needed support from or were coming into contact with different policy areas and different types of services, and particularly where domestic violence was involved as well. But each of those services were operating in apparently quite a high degree of isolation, to the point where it wasn't just that clearly different organisations and different services have their own remit, and that's what they have to do, and that's what they're funded to do. But it wasn't just that they weren't kind of sufficiently aligned to prevent gaps. Often there were also conflicts between them. And so you have the kind of domestic violence refuges, and all of these different areas are doing extremely good work. The remit of domestic violence services and refuges often is about safety. It's about keeping women safe, and they do that extremely well. But as we saw in Nicola's case study, that then made parenting really difficult for her, partly because one of her children had to live somewhere else and couldn't come with her. So the kind of the responsibilities around parenting, her needs there are not met. Social services focused on the welfare of the child, of course they are. Children's social services, of course they are, because that's what they're meant to do. But as Emma just explained, housing was often not recognised as an essential component of maternal care. So the housing need of Kelly, for example, who lost her child because she had nowhere else to go but back to the violent partner, that kind of what wasn't recognised, that what she had there was a housing need. Housing and homelessness services, on the other hand, did provide temporary accommodation for women. They met that immediate need of a roof over their head, but as we'll come on to see, often disregarded their family status, their maternal identity and responsibility, and so they were given accommodation for single people or whatever. And so you had these sort of different areas just not coming together enough to fully meet women's whole needs, but also there were conflicts. So children's social care were often placing responsibility on the homeless mothers we interviewed to have or access suitable family housing before they could be reunited with, or for them to keep their children. But there were aspects of housing and homelessness policy that totally undermine their capacity to do that. So there's three things we've picked out here. And I was just thinking about Nicola again, because one of the things that had happened to her, and I can't remember if you went through this or not, but one of the things that was happening to her as well was that the housing authority was offering her accommodation where she wanted to be, which was in Harriet, in her city of residence where her eldest son was, that she couldn't accept. I think you said that she couldn't accept because social services were saying that if she went back to that area, they would remove her youngest child. But the housing services were telling her that if she didn't take it, she'd be intentionally homeless and they would discharge their duty. So she was literally caught in a trap where she couldn't accept housing and keep her children. And so then there were quite a lot of examples of that, quite complicated examples. But one of the really key things that we want to emphasize is about the way that the distinction in the homelessness policy between family and single homelessness in England operates. And so for quite a lot of the women that we interviewed, when they became homeless or just before, or they were living apart from their children because of homelessness, sometimes other situations as well. But at that point, they were then treated as single, and so they were not entitled to family housing, or they were not given priority need at all. And then they were totally unable to reunite with their children. I've got a couple of quotes. I'll come back to this slide, but here's a couple of quotes that really illustrate this. So Emma, I'm only entitled to a one-bedroom flat. So I'm going to have to convince a court to allow me to sleep on the sofa in the living room and use the bedroom for the girls. That's clearly not going to happen. So how can the children come back to be housed with me if I haven't got a big enough house? But they won't give you anywhere until the children are back. It's catch-22, and that absolutely sums it up. Similarly, Roxanne, her partner, and they had a long history of drug abuse, I think, didn't they? But they'd absolutely dealt with all of that. And social services were in a position where they were saying, in terms of their capacity to care, they could have the children back, but they wouldn't because they were in a hostel and they didn't have anywhere to go. Similarly, Rosaline there, one of the stipulations of getting my children back, this is on the care plan put together by social services, is that I'd have a 3-bedroom house, but I'm here as a single person, I only get offered a 1-bedroom flat, what am I supposed to do? So that kind of one policy area sort of undermining another. Also similarly, we see it in intentionality, the application of intentional homelessness, and a number of the women that we interviewed had been found intentionally homeless, often because of things like rent arrears that were accrued by violent partners, but it's their tenancy, they're the head of the household. So there was a real sense of kind of assessments that were being made that were not taking into account women's full circumstances and a kind of understanding of how they'd arrived at this particular point in time. It was almost as if whatever the very immediate situation is and just the bare facts of it, that is what you're assessed on. Sorry, go on. Yeah,
I was just going to jump in and say 2 of the 3 quotes that we just read out there, those women had experienced very brief periods of difficulty with mental health and or substance issues, and that was following some really difficult life events. And so what we saw happening was a very sort of brief sort of contained period following a difficult event, those women struggling to receive support and actually placing their children voluntarily with family members whilst they sorted those problems out. So with the first quote, Emma, I think it was, she placed her children with her sister, and Roxanne had placed them with her parents. But rather than being then able to have their children back, it felt that as soon as the children were gone, they're temporarily placed elsewhere. As soon as they'd worked through those issues, that was it. They faced really almost insurmountable difficulties in getting their children back.
And both of those women said they had addressed those issues. Emma was sober, their mental health had improved. Absolutely. We have put Emma's fuller case study in there. I'm not going to go through it because it is really interesting and it is also in the report. I didn't know if the slides would be shared, so we put it in anyway, but we won't go through it. Now some of the rest of what we've got to say will have already been kind of implicit, but there's a body of academic literature that talks about this sort of pervasive view of the mother protector, and Emma sort of hinted at this at the start of the presentation as well, this kind of view that it's the mother's responsibility, regardless of actually where the risk originates, and whether the risk originates with a violent man or the risk originates in a situation of poverty. This notion of the mother protector is really pervasive, and that as a result women tend to be the ones who get blamed for situations, and this was really strong in the narratives of the women that we interviewed. We haven't done interviews with policymakers, with practitioners or anything else, and we're not here to criticize any practitioner, but this is how the women really felt, that and you can see it, that they were being held responsible for and bearing the consequences of the actions of others, and it is usually violent partners. And I think Nicola's quote up there really strikes me. It was emotional abuse. She had her children removed because she was in a situation of domestic violence. It was emotional abuse, they said it was, because apparently I were letting them see me getting beaten up all the time. Now, of course, from a social worker's point of view, there's a child in a violent household that needs to be protected. So, there's no question about that. But if you step back from that and think, so Nicola is made responsible here and loses her children because she was allowing them to see her getting beaten up, and there was quite a lot of that, women letting him beat me up and the children being there, and so in that sense, although we do acknowledge that the safety of the child is absolutely paramount, for those women there was that, there didn't ever seem to be any action against the men, actually, but we weren't looking into that, but they really felt responsible. We saw it in at the start with Harriet. It was her responsibility. She couldn't go back to her city of residence where her support network was, because her violent ex-partner still lived in the area, and that would be a failure on her part to protect her children from him, because she can't stop him stalking her.
I think this is, we started out in this research looking at housing, and it very quickly became apparent that we needed to look at children's social services in relation to child protection. But the other area that we didn't have the sort of resources to go into in enough depth, but we'd like to take that forward when we develop this research, is the kind of criminal justice side of domestic violence, because it was such a consistent response from the women we spoke to that there was nothing more that the police can do. I had to leave, I had to get out of there, and there was just this real sense of just constant threat, and the responsibility being completely with the mother. Now, as Kesia said, we didn't look into that in a lot of detail, so it's something that we need to understand more about in terms of what was going on there.
But certainly in their stories, they didn't, it was their responsibility to take out the non-molestation order before they were then allowed to enter that city again, and things like that, so absolutely. I'm conscious of time, so I'll move on from that, I think, and hand back to Emma for our final theme.
We'd like to make really clear that there were lots of examples of brilliant support offered by the various forms of temporary accommodation that the mothers we interviewed were living in. So it ranged from domestic violence refuges to hostels, more supported forms of hostels, some for younger women and young families. And there was some brilliant examples of support. But also, kind of overall, there was a real inadequacy in the sort of suitability of those services, sort of physically, as well as in terms of the way that they were sort of managed and the sort of mix of people in there. So to start with, it was really striking that none of the mothers that we spoke to described receiving any aftercare after having children removed. So children were removed, women were placed, ended up in temporary accommodation, or they'd been in temporary accommodation before, but they were sitting there pretty much in isolation of any support, often with really sort of quite serious mental health issues.
And actually there's no physical follow-up either for women that have had children removed at birth.
That was a particular issue with mothers in prisons as well. So it was just really striking that women found themselves in these situations without any sort of really intensive support for such a traumatic event. Overall, the physical accommodation that women were placed in was often far away from schools, far away from their children if they'd been moved away from children, far away from family and support networks. Now that is kind of very normal and often a very important requirement when responding to domestic violence, moving the mother away from a violent partner. And Janet Bostad has written an awful lot on this. But actually that was, of course, really, really problematic in terms of the isolation that this created. It also didn't take into account the lack of financial resources the women that we spoke to had. So in moving women away from family and support networks, they were unable to get the support that they needed to help with parenting. Refuges and hostels often have very strict regulations, so no visitors allowed, often restricted women to bedrooms, families to bedrooms, so you weren't allowed to use communal areas. So there was this real sense of being trapped and being imprisoned. That was a term that was used frequently. And without the financial resources to take children out for the day or to go and visit children if the mothers weren't with them at the time, they just felt really stuck. There was other implications. So taking children to school, often there wasn't enough money to make the many bus routes to get children to and from school, and also to make the journey to children's contact centres, which were a requirement of children's social services. All of these things made doing that very, very difficult. And you've also got to remember, if someone's fled domestic abuse, they might have fled, you know, in the night, not brought any ID or anything like that. So women were sometimes arriving at hostels without any benefits being set up and having to wait very long periods of time before benefits were put in place. So relying on sandwich handouts from local supermarkets and with no other means to buy food or support themselves. There was also a sense from some of the mothers we spoke to that there were particular practices, conditions of stay in hostels, which included chores. Some of these things included cleaning tasks in communal areas, which the mothers, you know, having fled violence, found themselves in a situation where they're in a refuge or a hostel, were suddenly being told to do cleaning tasks and felt like they were being judged, that they were being treated very differently, that they were problematic, and felt really kind of degraded through those practices.
It was sometimes expressed as being a bit reminiscent of what they'd left, you know, those kind of requirements for maybe sometimes no apparent reason, and
so fleeing one situation of kind of control and loneliness and sort of abuse to another, and that those were not representative of the entire sample, but there were some examples of that which were quite troubling, really.
Okay, so finally, a few fairly random reflections, really. The first one, I mean, just to point out, you know, for those of you that have seen CaCHE Come Home, a lot of people will have done, you know, and I know that was a drama, but meant to be reflective of reality. You know, CaCHE basically had her children removed because she was homeless, and, you know, I'm not saying it's quite that clear cut, but there are women here who are becoming separated from their children or unable to reunite with their children because of their housing situation. You know, how can that still be the case? And to go back to this kind of conflict, you've got two areas of policy that are essentially working with the same women who want to support and protect those women, and actually in some cases they're working against each other and undermining stable family life and housing. So there's got to be an urgent need to scrutinise that a bit more, and I'm sure that could be changed fairly easily. So what we would like to do is kind of begin a research agenda which starts bringing together looking at housing and children's social care policy together, and also the academic disciplines around that, bringing those together. So we think there could really be some good cross-understanding there. But also to point out that there is good practice out there, and we're planning to write some policy briefings. And so we want to look at some of what practice is out there and what can be done. There are positive policy developments. There's the domestic abuse bill, which is on hold, but that was going through. The recent report we came across by the Shared Health Foundation that's developed some kind of standards for housing families in temporary accommodation. So there's some really good work out there that, you know, could help us build better responses to some of the problems that we've identified in this presentation. And that's it. Thank you very much.
Thank you
for listening.
Thanks very much, Emma and Kesia. That was obviously fascinating. I think it really brought to life the experiences of those homeless mothers. You know, and this, what I got out of it above all else is kind of the sense of entrapment in the system. So, I mean, I'm gonna self-indulgently kind of express a couple of my kind of initial thoughts, and I'm gonna go through the questions that have already been the participants have already put forward. I'd welcome any participants. Please, just if you have any questions, just put them in the group chat, and we should be able to get through them all, hopefully. The first thought, I mean, it's what came out of me is kind of the way state classifications of single and family almost became kind of self-fulfilling. And once a state kind of classified you as single, it almost, the whole kind of architecture of the state and kind of rolled in behind that definition. Kind of, it was extremely difficult for you to actually to challenge it and to actually retain a family. And I found that really came through me. The other thing that really came through me is, I read last year a book called Radical Help by Hilary Cotton, who's a social entrepreneur, and she talks a lot about kind of how the different parts of the welfare system have are first of all very concerned above all else with risk limitation and with minimizing the risk that they actually have to, and by arms of the welfare team, I mean the police, the social services, they're all concerned with minimizing the risk, and they're all concerned with a very narrow set of objectives, and therefore the actual situation and kind of capabilities of the person, in this case the homeless mother, are kind of forgotten because amongst all these kind of these very narrowly defined objectives. So that's kind of those are my initial thoughts. But I'm going to go to the kind of we got quite a few questions here. I'm going to start with Rachel Casey, who's in charge, partly in charge of policy at the Joseph Foundation, and has some experience in working in children's social services. And she's sort of asked, she's quite interested in the experiences of women who are being threatened, who were threatened with having their children taken into care, with a threat because of the risk of homelessness. With the risk of homelessness being actually invoked as grounds for children. And so her question is, was that how common was that, or how common do you sense it is amongst the broader population? And did those women not have any recourse to local authority, to public funds to vend their case?
I think more commonly, it would be rare for a situation where the only issue that a woman faced was homelessness and her children were removed from her just on that basis. I would say that is rare, yes. What there was definitely was where a threat of homelessness, I'm thinking about Emma here in particular, a threat of homelessness was then used as, well, no, actually, I mean, Emma's case study is quite a good one, because so the situation she was in was that she described having had a kind of low-level alcohol problem, but a managed one, and everything was fine. Then she discovered she was in quite significant rent arrears because of housing benefit stuff, and started drinking more heavily so she was then threatened with eviction, started drinking more heavily. That is what prompted, according to her, social services intervention. So it was the combination of those two things, although the drinking had got worse because of the impending eviction, and it was suggested that her children were placed with family members while she sorted herself out. So you know, not just homelessness, but actually the homelessness and the threat of homelessness in that situation was the key. I think what was more common, though, was where women had been separated from their children for a constellation of reasons, for example, like in Emma's case, and then things had sorted out. So it's that period of short-term period of crisis that Emma described, and then they couldn't have their children back because they were still homeless. So that definitely was the case. There were women whose only remaining issue was their homelessness, and the children were not being returned to them for that reason. So that's more common, I think.
Yeah, and I think in those situations, social services would judge that the welfare of the child was actually better off where they were. So there'd been a temporary period where the child had been with another family member, for example, and it was deemed that, well, actually things are working out pretty well now, and we think it's best in the child's interest for them to stay here. I actually spoke to a solicitor who worked with families in the family courts before we started this research, and asked that question, you know, if someone was to lose their children due to homelessness and that went through the courts, what would happen? And her response was, well, if that was to reach the courts, the judge would likely tell the local authority that that was an appalling failure on their part, and that they had to immediately resolve the housing issue. But it was never that clear cut. There was always,
it was often not.
It was often often rested on the other social problems, and the housing sort of lost its prominence.
Yeah.
So I don't know if that answers the question.
Yeah, it sounds like, sorry, someone's talking. No, it's me. I can hear the echo. So the other kind of one of the other questions from Sophie is who's based in Wales. Is there's kind of is it relates to the history of these mothers, and did they themselves have a history of kind of being in social care themselves?
Oh, that's a really interesting question, actually, and I'm not sure that's something that we know. Not very
well. I mean, the way we kind of went about these interviews, because this research was just inherently so upsetting. The subject matter was so upsetting. The interviewing approach that we took was that we would basically have a discussion, and we wanted to hear the accounts of the mothers themselves, and sort of started off very loosely, tell me about your housing history. And we didn't necessarily probe too far with questions like that. Some of the mothers we spoke to, a couple of them had mentioned that they'd had they'd become homeless at the age of 15, for example. But we didn't specifically look at mothers who'd been previously in care, and I think that's a really
I think that is a really interesting question. But my sense, just knowing what we know about the women, I would say there may well have been some that did, but not to a great degree. But that has raised something else, which I think is quite important to get across. Is by the time we interviewed these women, they were clearly very vulnerable women. They'd been through all. But a lot of them, some of them had very difficult lives. They'd become homeless, very early on. They had long-term drug problems and so on. But actually, most of them had lived pretty stable lives, raised their families. So we're not actually talking about a group of people who are sort of people with complex needs, who have always had complex needs. At the point at which we interviewed them, often they did have by that point. But some of them were not. They weren't care leavers, they weren't people with long-term drug problems and so on. They'd had, they may have been, they were economically disadvantaged mostly, but they had relatively stable lives, quite a lot of them.
Yeah, there was, for example, one of the women we spoke to, she was in a refuge with her 2 children, and she'd been there for 10 months. And she had previously been studying for a master's. She'd been doing an evening course, and everything was completely on hold. And because she was in this refuge, she had to stop her course. She couldn't work because, of course, if she worked, she wouldn't be entitled to benefits. And the cost of being in a refuge in terms of benefits is so enormous. Her life.
So they were made kind of more. It was reinforcing a sort of level of poverty and deprivation that wasn't always there before. Yeah. Anyway, we're going off the point slightly, but yeah.
Great. Kate Davis from Australia, where apparently they face similar challenges, is interested in particular in the specific process of them being made homeless, evicted. Who was doing the eviction? Was it public authorities doing the evictions?
Yeah, mostly.
What was the role of housing? Was there any role for housing associations?
Yeah, it was usually social housing. I'm trying to think. Yeah, it was usually social housing rather than private, wasn't it?
Yeah, in general. But for some of the women, they hadn't been evicted. They'd had to leave. They'd had to,
of course, for domestic violence.
They'd had to flee domestic violence.
Yeah.
But it's important to note now that as for many of the women who had fled a situation of abuse, because they had voluntarily left, some of them suggested that they had been told that they were now deemed to have made themselves intentionally homeless by absconding their tenancy,
that's not legal. That's not, they should be given priority need.
Yeah. So the way that local authorities were interpreting their new situation of homelessness was actually creating an obstruction to them being then rehoused because they hadn't met the conditions of a previous tenancy. There also might have been debts left either through themselves or through partners, and that was quite commonly cited as a barrier. You're not going to make it on the housing list because you've got X number of arrears, so we can't help you with that.
But it was mainly public social housing.
Great. Just a final couple of questions. So I mean, there's a couple of questions here about about the policy implications. So there's one kind of question is from Sarah, who's sort of asking whether what implications does your research however tentative those implications may be, for kind of the bill around priority need, and the kind of the definition of priority need. And then there's another kind of question from Jessica in Scotland, who's kind of interested in whether you think, given the different policy, I suppose socio-demographic context there, whether you'd expect those findings to apply here, there, whether, because this study was focused particularly in the north of England, whether you'd expect any kind of geographical.
I mean, we can probably deal with the second one of those quite easily in terms of Scotland. That, you know, one of the fundamental problem, there were lots, but one of the fundamental problems that the women that we interviewed faced was this distinction between single and family homelessness. And obviously that doesn't exist in Scotland, I mean, in a positive way. And so, you know, that some of these issues should not arise in Scotland.
So, yeah, in Scotland, if I'm right in saying so, priority need categorization was removed in terms of that eligibility criteria, but I think intentionality might still come into it in practice.
So that's, I think that's why I'm saying it's not, it doesn't solve everything, but one of the key problems which would be a policy recommendation, to go back to Sarah's question about the implications, is the way that is dealt with. I mean, you could get rid of it altogether in England as well, but the way that is dealt with absolutely needs to change. I think it's worth pointing out, though, and we do this in the report, that local authorities, if a woman approaches a local authority as homeless and she would usually be living with her children, they can give her priority need on the basis of being a family. They can assess her as a family, but none of the women in our sample, or actually any woman that I've ever interviewed in that situation in 20 years, has ever been given priority. And I think partly that's because the situations often are quite complicated, or the right questions aren't asked, or whatever. And so I think a lot of the implications of this and the changes that could happen are more about how things are implemented, how priority need is assessed, you know, how the decisions about family and single people are made, and how those are implemented. Intentionality, you know, you don't find a woman intentionally homeless if she's got rent arrears because she's had because she's been in a situation of domestic violence. Just don't do it, you know. Get that in the guidance. If you're fleeing domestic violence, you don't apply intentionality. You know, it's easy. And so and so there are other problems as well as the priority need, but I would think that in Scotland it would be different, because that was an issue. There are, to go back to Sarah's question, we're currently thinking through the policy implications. There are obvious ones around priority need, around assessments of being family and single. There are real implications for the way that temporary accommodation is provided. There's implications around sort of just recognising women in these kind of situations, understanding that family circumstances are fluid and they change when people are at points of crisis, and recognising the maternal identity of women in those situations. So we hint at some of those at the end of the report. We want to get these right, and we want to choose the right ones that might be listened to work up into a policy report. I don't know if you've got some things to add to that.
Yeah, I guess just to add to that is the need for housing and social services to work together better, which is nothing new. You know, if you worked in housing or social services, either within a local authority or in a housing association, you'll know how difficult it is to connect those two services, those two areas of policy, different ways of working, just really basic communication issues between social workers and housing officers in local authority housing offices. But it's absolutely crucial, because it just feels like the priorities of each are clashing in a way that is detrimental to families either staying together or for the chance for families to reunite after periods of separation and difficulty. So it's, we need to work on how we want to articulate that, and try and focus in on some of the sort of more practical elements of that. But these are all things that we're going to be developing, hopefully, further with this research, and bringing in more sort of practitioners and academics who understand these areas of social work.
I've just seen a question pop up. Was it Rachel, Kesia, or something saying, do people think that the gatekeeping is a product of the shortage of social housing? I don't know if they carried on. That was the bit that I saw. So I'll just say yes to that.
Yeah, absolutely.
Yeah, that kind of, Rachel kind of read my mind there, because I think, well, I was reading hers, because it strikes me as the motivation of the local authorities for interpreting that kind of stipulation about whether someone's a family or not so ungenerously seems really intriguing. I suppose one it'd be really interesting to get their perspective. I suppose one explanation is that you're only interviewing the people who they've been most unreasonable to, and there can be lots of cases where they've been unreasonable and judged them to be families, and therefore you haven't got them. So you might be getting the worst possible settlement, but it also
we would be, of course. We're getting the people that are still homeless, so they haven't
exactly. But it may also be something much more systemic, and there may be some kind of real systematic bias there. And so,
there is evidence of gatekeeping. We all know it. Anybody that works in homelessness knows, that some people don't even get to the point of making a homelessness application, and that. When I started 20 years ago, that would happen in London, but it wouldn't happen in Leeds, because Leeds had social housing. They would give social housing to, and then over the 20 years that I've been working, that has changed. And, as housing gets more scarce, suddenly fewer people are given priority need. I mean, it's,
And it's, then you've got to think it's not just about availability of housing, but it's where the housing is. So a mother might not be too keen on accepting some housing that's been offered because it's just totally impractical for her to be able to get her children to school or to meet the requirements of children's social services if it's attending contact centre appointments and all these absolutely critical things. If she's offered a house that's going to take 2 hours, she can't afford to get there, no financial provisions are given, it's these are really sort of tricky circumstances, and so some of the options that are offered are just totally unsuitable.
So Sophie's come in and kind of backed up kind of the argument that gatekeeping is extremely strong with the local authorities, makes forcing kind of difficult decisions. And just a kind of last question to close. If any of our participants have any final questions, do put them in the box now, because this is the kind of last question I have on my list. But we still have 7 minutes if you have any more to add. But are you going to share the findings with them, with the participants? Have you, and how have they responded to them, if you have?
That's tricky.
Yeah, we have details of some that we certainly, when we're committed to sharing them. There were actually, there was a woman who was really keen to be involved in, we had a symposium, really keen to be involved. And when we went to try and find her, she was no longer there. So actually accessing finding the participants again is difficult. But we want to make sure that that's disseminated to them as well, and that they have access to the report.
We'll do it primarily through contacting the organisations who supported us with the research. So the Women's Housing and Support Services will ask them to try and forward on the report if they know where their clients have gone to, because hopefully a lot of them will have moved on into housing.
We made sure that all of them had our contact details as well, because like I say, when we've tried to contact some of them afterwards, those numbers are no longer valid and things like that, but they do have ours. So we made it clear to them, invited them to, they could get in touch with us. So it's disseminating through the organisations, or where we have their details, we will send it to them.
Great, thanks very much, Kesia. That's been fascinating, and thank you all for joining and for participating so keenly and with such well thought out questions. The report is now on the CaCHE website. If you haven't already read it, you'd have to be very keen to have read it by now. I'm sure Kesia would be delighted to answer any follow-up questions or inquiries. And thank you all for participating. Kesia, do you have anything to?
Thank you very much.
Just to say thank you to everybody for coming along. Thanks.
Oh, lovely. Thank you.